if you wouldn't mind, would you each introduce yourself and share why you either started the company or joined the company?
Okay, so I'm Dave Karen. I'm a pathologist. A couple of reasons for starting this company. One, I'm a BRCA family. We've had some bad things that have happened in my family. But we've also, after we learned about what was going on, we've been able to prevent things. And that's brought incredible joy to later generations. And so I was very interested in this. That's my personal motivation. How it happened that we started it, Lynn McCain and I, about 9 years ago, were trying to help the University of Michigan perform molecular tests only when they were really needed. And a lot of inappropriate testing was being done. And back then it was very expensive and hard to do. And so we worked with Blue Cross Blue Shield of Michigan. And she and I drove all over the state of Michigan, even into the UP. And we talked to clinicians everywhere. And we just learned from that. And it took us several months. And we learned from that, not at one time, but just many, many different trips. And we learned that physicians just didn't have time to take detailed histories. They don't do it. Some of them don't believe in histories, which was shocking to me because I'm an MD, I'm a pathologist. I took histories from many of my young years when I was in Chicago working at the University of Illinois. And the other thing is, even if they took the histories, they didn't keep up with NCCN guidelines. They didn't know what to do with it. They didn't know when it was appropriate. And so looking at that and then going back to the University of Michigan, where we were both working at the time, and talking to our experts in genetic oncology for both breast, colorectal lesions, Lynch syndrome, BRCAs, and then putting that together with my own life story of my own family, we decided that we needed to put something out there that would help clinicians and help patients and help laboratories. Labs don't like doing tests that are inappropriate, at least they shouldn't. So that's sorry, it was a long story, but that's my motivation.
Well, it was a great story. So, and I'd love to hear the familial part out at some point. So Lynn, would you like to share a little bit about your background and why you got involved and started the company?
Sure. I'm the COO of the company, and my background is in health administration. And as Dave was saying, I was working at the University of Michigan at the time, and worked with him on this project to identify what is the best way that we can help clinicians and patients in getting appropriate care. As I got to know more about genetics, because going into this, I was I had a basic understanding of genetics, but I was not really familiar with the field. But as I got into it more and more, I was like, wow, my family has this. Wow, my family has this. And so for me, it became something that made me much more aware of that I could be at risk and needed to look at that. So, and I could see how devastating cancer can be in families. I've had family members who have died of cancer. I've seen the impact on their lives and on the family. And, if there's something that we can do to reduce the risk for other people, that's my motivation. I want other people to avoid going through what I've seen my family go through.
Excellent. Thank you. Amanda.
Well, thank you so much. So I'm Amanda Cook, the VP of Product Marketing. I started on the project shortly after Lynn and Dr. Karen secured the grant funding. So I came on bringing the insurance field of what my background is in, and needing to work with the insurance companies and dive into that aspect. And as we got started on the project, I was able to start diving into the technology pieces and also starting to look at the guidelines that are used from National Comprehensive Cancer Network. And I started looking at it from the patient perspective, and that I did not find much of what was in the guidelines being asked in the clinic visits. And then on a personal note, about 6 months after I started with the project, I had a stroke. And so at 40 years old, it was very surprising for me to go into the hospital and then learn I had a stroke. What I did not know, and what was never asked at my clinic visits, never dove into, was that I have a family history of stroke and I have a hereditary condition. So that puts me at risk. And if I had taken an aspirin a day, I could have kept the stroke away. And so that really drove my passion in having taken that college course in genetics and then sleeping afterward and not revisiting it. And then learning so much and how we can help. And it's not to put anyone at blame, but to say, how can we help this issue?
Say a little bit more about what specifically your company does.
The issue our company tackles, and if we look at this, and this goes back into our introductions, we're all familiar with saying that something runs in our family. We know that things are passed on. I have blue eyes, my brother's blue eyes, blonde hair, that kind of thing. But there sometimes that's perception and sometimes that's reality. And so when it comes to cancer or other genetic conditions, it can be very, very real. And we've seen that. I think everybody on the call has seen that. Approximately 1 in 5 Americans are at increased risk for hereditary or familial cancers. 90%, however, and unfortunately, are unaware of their risk until a cancer diagnosis is made. If we identify that risk prior to a cancer diagnosis, there can be preventions that are put in place, and we could reduce individual patient risk by up to 96%. So having that knowledge, there is that power in knowing. Having that knowledge ahead of time can really help on the prevention end. So, and if you think about this, we're asked, most patients going for their doctor visit, whether it's an annual visit or a new patient visit or just a return visit, we're asked about our family history in the waiting room. We're asked to either complete a paper, or sometimes it's on an iPad or a tablet, and it's a quick risk, basically, that what does your mother have? What does your father have? What does your aunts and uncles have? Try to recall your family history as you're in the office, as you're waiting for your name to be called. And it's every single time that we go into the doctor visit. So most of us, I know me, we rush through the form. We can't remember all the details, but these details are very, very important, and having that history is very important. So doctors struggle with identifying the patients. They don't have in-clinic time to interview patients and go through a detailed family health history, especially when we're looking at 3 degrees of relation. In addition, the guidelines keep changing almost daily. So molecular advances are happening daily, and it makes it a challenge for doctors to be able to keep abreast of that. So InheRET collects the family health histories, personal and family health histories outside of the clinic. Once a patient submits that information, we interpret the data against best practice guidelines and provide physicians and the patients with a risk status of whether or not the patient is appropriate for genetic evaluation or genetic testing. And if they are appropriate for genetic testing, which tests are most appropriate for that patient. So as you were stating about the BRCA testing in 2014, that could be a different scenario for the patient today, and we need to order a full panel test for a patient. Excellent. So it streamlines the workflow for primary care, genetic counseling, laboratory testing, downstream care. Patients can log in. It's the patient's own data. So the patients can then log in at any time they want and update their information. And every time they update their information and submit it, we reanalyze it against the most current guidelines.
Who specifically experiences this kind of problem? And can you share a story of how someone experiences this?
I mean, there are a lot of different there are a lot of different people who experience this issue, and the issue comes from different perspectives. If you're a primary care physician, you have reducing reimbursements, and so you're forced to see more patients in less time. So you have to really focus on the problems, not on prevention. And so InheRET comes in and it's a solution to that problem. And we've created an engaging and interactive family history tool that patients can share with their family members. We remove the barriers and strengthen the patient-provider relationship by having the patients really engaged in their healthcare. And, so by the time the patient comes in to see the physician's already aware of the red flags. So they don't have to spend the time collecting this information and trying to figure out what to do with it in the office. It's already there. So that really helps the providers a lot. If you're looking at as a genetic counselor, if you're using InheRET, you have the full family history, the drawn out pedigree, the analysis of the data right up front, and that saves you a tremendous amount of time in prepping for your clinics. And we found that one genetic counselor can see an extra 144 patients each year, which can drive significant revenue for the clinic, as well as shorten wait times for the patients. If you're looking at an integrated health system, they benefit a tremendous amount because not only do you get these high-risk patients identified, you eliminate inappropriate care that may not be reimbursed by the insurance coverage. You ensure the patients get the best care and improve their outcomes and those metrics. And you also drive downstream revenues so that your health system profits more from the care of these patients, and the patients are doing better. And they're happier with your health system as a result. So your quality metrics go up. So there's a lot of different ways that InheRET can impact different populations. We're even looking at employer groups. There's a lot of employer groups now that are starting to offer genetic testing to their patients as an employee benefit. And, that's expensive. If they offer InheRET first, and only the 20% or so of the employees that are truly at increased risk then go on for genetic testing and get the appropriate genetic testing, it can really save the employers a lot of money and improve the outcomes for their employees. So there's a lot of benefits for a lot of different groups.
And can you speak to, my understanding is that there is a incredible need for geneticists, and that that's part of an issue as well.
Absolutely.
Yeah,
Absolutely.
Genetic counselors are way not nowhere near enough genetic counselors, and we work with them quite closely at the University of Michigan. But even at Michigan, we had a backlog of 400 patients before we did our NIH study last year, and the NIH study took that backlog and eliminated it, just because it improves their efficiency. How it works is this. When people have an appointment to come to the University of Michigan Genetic Clinic, they are sent, the tradition is to send a form for them to fill out. It's about 20 pages or so. It's quite an extensive form. And they can't be seen until they get that filled out. And it takes them, some people never fill it out. And about, I forget what number, I think 40 or 50% of the people just don't fill it out, and then they're lost to the clinic. What we do now is they send out a link to the patient. The patient clicks on that link, one click, takes them to our HIPAA compliant website, where they take our history, which is their history. They've created this history. This is not from this old pathologist. And it's also written at a 4th grade reading level so that underserved populations can be served with this. That's very important. I grew up in Chicago. I first saw patients at Cook County Hospital. Underserved patients are a large number of people. So with our system, we can deal with them. And then after they take that, immediately it generates a pedigree of that patient. It tells the physician and the patient what specific mutations would be appropriate to be testing for. So it pre-authorizes information that insurance companies will need. And so that's basically how the system works. And the amazing thing to me is, you look at some of the interesting individual stories we've seen. There was a person at, one of our studies was done in a neighboring town, Dexter, Michigan, where it's just a small practice with, they saw just plain old folks. And the doctors there were kind of dubious because, we know our patients, we've seen them for years in the clinic, they live down the street. And so we found one patient that Amanda will remember, and she'll be able to fill me in because my poor old brain doesn't remember. But the patient was told, the doctor was told that that patient was at increased risk. The doctor said, wait a minute, I know that patient. That patient doesn't have any increased risk. But there wasn't. Do you remember the specific? So you fill it in. What happened?
So the guidelines had just changed to include pancreatic cancer screening for first and second degree relatives. So if you have a first or second degree relative with pancreatic cancer, that you are appropriate for genetic counseling, just in the penetrance, because of what they found in the penetrance with the pancreatic cancer. So the physician came back to us and said, your report's wrong. This patient shouldn't be referred. And we were able to come back and say, the guidelines have just changed and this patient should be referred. And then the physician said, oh my goodness, I had no idea. Thank you so much for letting me know. And I'm referring the patient now. And then that patient was referred on and was able to obtain the appropriate counseling and testing.
It's so amazing to see the difference. My own physician's office here in Ann Arbor, we interviewed them to see how they would be interested in, and some of them just weren't interested in doing this at all. They don't think history is important at all. And I was kind of shocked by that because I learned that history is a very important thing. I mean, it's part of my story. You wanted to hear part of it. I'll tell you one more part of my story. So back in 1968, when I was a medical student at the University of Illinois, I took a history on a patient, and she had complaints of she had shortness of breath and trouble walking upstairs, and she was just barely about 50 years old, and it sounded like congestive heart failure. So I made my diagnosis. This sounds like congestive heart failure. But then I went on with the history to learn that this woman had her younger sister died of breast cancer when she was in her 40s. And then I took a little better history of this patient, dumb young medical student. I found out, oh, by the way, doctor, I had breast cancer 7 years ago. And of course, that was what the problem was. This was my then-to-be wife's mother.
Wow.
And we got married the next June in 1969, and her mother was still there. But within 5 months, her mother was dead. So she had lost her aunt and her mother. So we knew about this history, but we're talking now 1960s and 70s. Nobody knew about genetics. We knew there was something going on, so we had my wife followed more closely. Once a year by a breast surgeon, and once a year by her gynecologist who specialized in breast issues. And you know what? With all that and imaging, when she was 35 years old, she found her own cancer. And at that time, she had metastatic disease. So she was 35 years old. So I've got a picture of my wife with our 6-year-old daughter at that time. And before and after, and then she had a bilateral mastectomy. It was stage 2 though. She had a couple nodes positive. She had a bilateral mastectomy. She underwent 5-drug chemotherapy then, which was very new back then. Al Buglio did it here at the University of Michigan. But she stuck with it. She got some bad side effects from that, which she still has to this day. But she and I celebrated our 52nd wedding anniversary last Monday. History is key, and you have to take a good history. And it saddens me that they don't have time, and I guess they justify why they don't take histories, but that's what we do. We make it easy for them. We take a complete history. It's 100% agreement with our genetic counselors at the University of Michigan. We've done studies on that. We have studies on over 2,000 patients, over 1 million in silico studies, looking at different situations. We can pick these all up. We've just published a paper in NCCN about our study. It's coming out, well, anytime now. It's in print.
In press.
In press, thanks. And we also have another one about the finances involved, and another one that's in the works, and another one about the cost effectiveness of what we do. But to me, in my heart, the effectiveness of what we do is we make it easy for physicians to do the right things for patients. patients who are underserved are served by what we do. I know there's other companies out there that do this, but I think, we're the only one that has gone in this detail. I'm not the expert in this. Dr. Mariver, who works with us, sits on the NCCN guidelines committee. So, we know what we're doing.
Do you have all your team in place?
We have we're going to be continually growing. I'm sure that as we pick up more individuals, as we pick up more clients, we're going to need to increase our customer support. One of the things I learned from running that laboratory is that you have to be there like that for your customer. You have to be very customer friendly. You have to make it easy for them, and you have to have knowledgeable people. So yes, we will be expanding our team. It will be in sales and marketing initially, but as we accrue clients, we're definitely going to expand the customer service. And then of course, there's our IT group. A lot of what we do is IT stuff, and that will have to expand as well.
So are you looking for any kind of support outside of financial backing?
Yeah,
Yeah,
definitely.
definitely.
I think, having those connections in the industry, any technology advice. We're also, I think, looking for possible board of directors or advisors, advisory board positions. And then, of course, introductions to other partners and health systems, providers, funders, grow the network as much as we can.
Is there anything else that any of you would like to share?
I just want to thank you for your time. I mean, we've heard about you, and I was delighted to meet you. And it was kind of fun sharing our story and hearing a bit about you.
Thank you for watching the Lowdown on Cancer presented by the Cancer Fund. To learn more about what's coming in future episodes, visit us at www.cancerfund.com. While you're there, check out past episodes and be sure to click Join Us to become a member of the Cancer Fund community. As a member of the community, you'll receive early access to new interviews as well as other announcements. Make sure to connect to all of our social media channels so you don't miss a thing. In addition to getting early access to new episodes of the Lowdown on Cancer, Cancer Fund members play a critical role in driving cancer innovation forward so that one day we can more than hope. We can actually beat cancer. Thank you for joining us on this journey.